Pregnancy is the main event in the life of a female mammal to reproduce its progeny and maintain the integrity of the species. It is a very coordinated process involving reproductive organs and changes in the tissue concentration of hormones. Various hormones are involved in the preparation of the uterus from the conception. Progesterone is the key hormone of pregnancy and is thus called the pregnancy hormone. It has several actions that are essential for maintaining a normal pregnancy. These include providing negative feedback to the hypothalamus to inhibit any further estrous cycles, inhibiting the smooth muscles of the uterus to permit the attachment and development of the fetus, and assisting with the maintenance of the contractility of the cervix to protect the uterine environment. Plasma levels and sources of progesterone differ among species and among stages of pregnancy. In all domestic animals, the initial source of the necessary progesterone is the corpus luteum, and in some species, example given, cow and sow, the corpus luteum remains primary source throughout pregnancy. In other species, example given, mare and ewe, the initial corpus luteum can be removed after secondary sources produce enough progesterone to maintain pregnancy. These sources include secondary or accessory corpora lutea and the placenta in the mare. The placenta is the secondary source in the ewe. The mare appears to be unique among domestic species in that the equine placenta is the source of a protein hormone that acts similarly to the luteinizing hormone, the source of which is the pituitary. Secretion of equine chorionic gonadotropine, or ECG, formerly known as pregnant mare serum gonadotropine, or PMSG, begins after a month of gestation and continues until about 4 months of gestation. During this period, follicular development occurs on the ovary of the pregnant mare, and ECG promotes the luteinization of these follicles. This accessory corpora lutea provides secondary source of progesterone. The last one is the relaxin, which protein hormone secreted by the corpus luteum, some species, sow and cow, and the placenta in others, bitch and mare. The primary function of the relaxin is preparation for parturition and ultimately lactation. Relaxin contributes to the opening of the cervix and the relaxation of the muscles and ligaments associated with the birth canal to facilitate the passage of the fetus. In some species, peak secretion of relaxin occurs just prior to parturition. Gradual increase in relaxin during the latter part of gestation also facilitate mammary gland development to prepare for lactation.